Hi, I'm Dr. Sneha, Medical Oncologist at Aster RV Hospital, Bangalore. So, most of the times patients ask me one common questions. Why I am getting cancers and how do we get cancers? What are the risk factors associated with? So, I'm going to answer all these common questions which usually anybody is asking all the doctors. So, first question, whether everybody will get cancer? No. But what are the risk factors associated with cancer? Yeah, there are risk factors associated with cancers. One is definitely age, and the other one is genetics, that means hereditary. Then the third one is the environmental exposure. By environmental exposure, I mean it can be tobacco, oral, as well as smoking, or the occupational, the one who works with paints or fertilizers, pesticides, rubber industries, asbestos industries, or the one that are exposed to the chemicals. And next one, coming to the hormonal exposure, as a kid or early menarche, late menopause, and also hormonal treatments for various reasons. And the fourth one, coming to which can be prevented, is mainly because of the lifestyle, which means what about the food consumption, exercise, obesity, and the processed food items. Next common question, whether we can prevent cancer or any cancers that are preventable. Yes, cancer is preventable and it can be prevented with vaccination as well. Like we see in case of cervical cancer, it can be prevented with HPV vaccination. Similarly, liver cancers, which is most of the times associated with viral infections, can be prevented with hepatitis B vaccination. Safe sexual practices and avoiding multiple partners also prevents cervical cancers and also prevent the frequent sexual infections which may result in cervical cancers, and also chance of hepatitis B, C, which will again may lead to liver cancers. Then coming to how lifestyle modifications are going to reduce the risk of cancer and what cancers can be prevented with lifestyle modifications. Lifestyle modifications, yes, they only by modifying the lifestyles, that is your diet, exercise, you can reduce the risk of cancer by 30%, which is a very big number. That means in every 100, 30 can be prevented with lifestyle modifications alone. And like we see in case of breast cancers, healthy exercise, diet, and preventing obesity will control breast cancer and also will prevent it from coming. And also like we see in case of colon cancer and gallbladder is also associated with red meat consumption and the obesity, which can be prevented with regular exercise. Then coming to the tobacco, whether it is in oral form as well as in the smoking, it will cause all kinds of cancers starting from your oral cavity and even from the nasal cavity to the food pipe, stomach, and also the colon. All these cancers, urinary bladder, are caused by tobacco, and most common cancer which we see with tobacco is head and neck cancers and also lung cancers, which can be prevented from avoiding the smoking any kind of tobacco products. Coming to the most common topic, that next one which everybody is going to ask me is about actual screening. Is it useful or not? And the screening is only for old age individuals or who have some problems? No. Screening is for everybody. Screening is especially for people who are healthy to pick up any disease even before it happens. So that means they are not diagnosed with cancer. That means they don't have cancer, but we are just trying to see if there is any tendency to develop cancer. And yes, screening helps because it helps in early detection, and in some cases like cervical cancer, we can even detect the disease early so that it can prevent it from coming out as cancer. What are the cancers where screening actually helps? Cervical cancer. Women who are more than 30 years of age, they have to start screening for cervical cancers. The screening is nothing but a gynecological examination along with a pap smear, which has to be done once in 3 years. Sometimes it is also done in combination with HPV testing if it is done once in 5 years. And this screening helps in recognizing very early lesions which may later develop to cervical cancer. Next case where screening is very useful is breast cancer, and as a part of breast screening, what we do is a mammogram, which is nothing but an X-ray. Sometimes it is also done along with the help of an ultrasound to identify the lesions which are very early, or sometimes just to identify the lesions which are there and but cannot be examined by self, and also by a clinical examination. And this breast screening is done at least once in 2 years. For more information, you can visit us at Aster RV Hospital, Bangalore. The third most common question, for everything do we have to visit an oncologist, or when to visit an oncologist per se? So these are the common things that anybody has to look out for, even in kids for that matter. One is a lump anywhere which is persistent and is growing anywhere in the body. It can be a breast lump, it can be a neck swelling or an armpit swelling or anywhere. Fevers which are unexplained even after the normal investigations and non-treatment, or pneumonias which are not resolving, or blood in stools even after taking symptomatic treatment it is not relieving, or unexplained weight loss with or without any lumps, any altered bowel habits resulting in anemias requiring frequent treatment. These are all the scenarios where you have to visit an oncologist for more information. We are available at Aster RV Hospital at Oncology Department.